Well, good evening, everybody, and thank you for joining us here on Facebook. We are live on the Niswonger Children's Hospital Facebook. We'll be going live in just a moment on the WJHL Facebook, and we are good to go on our end as well. I am Josh Smith with News Channel 11, and it's a pleasure to be with you tonight. This our segment called Ask the Experts. You will be in the next hour ahead hearing from really some of the preeminent voices in healthcare, not only in this region, but also in our country today. And we're very, very fortunate to have access to people on the front lines, the COVID-19 pandemic, at a time when there's just such a need for not only information, but good information. Our goal tonight is to help dispel rumors, to help spread truth based on science, and help give you the information, you as a parent, you as an individual, so you can be informed and ready for whatever comes our way in the COVID-19 pandemic next. We are going to be taking questions to the experts tonight, as this is the first Ask the Expert series that we're doing here. And we're really hoping to solve some questions for you, maybe solve some mysteries, maybe unravel some misunderstandings. And if you do ask a question, we don't get it tonight, don't worry. I'm told that Ballot Health will be following up through the social media platforms and answering questions sent in by you. As we go through the hour ahead, if you do have a question, we encourage you to enter it into the comment. We'll do our best to get that question answered. Without further ado, it is our pleasure to welcome our first guest tonight. That's Dr. Buddy Creech from Nashville, Tennessee, joining us this evening. Dr. Creech is the Edie Carell Johnson Chair and Professor of Pediatrics in the Division of Pediatric Infectious Disease at the Vanderbilt University School of Medicine in Nashville, Tennessee. He serves as Director of the Vanderbilt Vaccine Research Program, and he is the Principal Investigator of the NIH-funded Vanderbilt Vaccine and Treatment Evaluation Unit. He's the co-principal investigator of the CDC-sponsored Clinical Immunization Safety Assessment Network. And Dr. Creech, his research interests focus on the development and the evaluation of new vaccines, new therapeutics, and also those are just a few of the hats that Dr. Creech wears. Before COVID, he was focused on vaccines, respiratory illnesses, influenza, whooping cough, staph infections, and since the pandemic began, he has been leading COVID-related trials at Vanderbilt University Medical Center. And his work with COVID extends to novel treatments as well for people who are dealing with COVID. Dr. Creech, it is an honor to have you here. Thank you so much for joining us here on Facebook Live.
Oh, thanks for having me. It's a real treat. I appreciate it.
I want to first get we're going to talk, I'd like to, about specifically information for parents as it pertains to children in just a few moments. We are dealing with very low numbers of vaccinated children here in our part of the state and part of the region. But first, I'd like to get your take on the late news that's coming out really today, and it's about the Omicron variant of the COVID-19 virus. What is known at this point about the Omicron variant? And as a second part of that you're welcome to tackle now, what is unknown and in your mind incredibly important that you want to know soon?
Wow, what a great question to lead with. I think it's important to recognize that we know some things and we really don't know some others. I now know what the Greek alphabet looks like. I knew Alpha and Omega, and then everything else in the middle was just a hodgepodge. So we're getting pretty good at that. I think it's probably better than naming it like we do hurricanes, because the buddy variant of COVID doesn't sound really, really good. We know that Omicron emerged in a variety of places, and it was identified first in South Africa, but this variant is quickly taking over the globe. And we get different reports in different areas, but it seems to be more contagious or transmissible even than Delta, which is more contagious and transmissible than the earliest versions of COVID. So that's number one. We know that. Second thing we know is that in vaccinated individuals, it looks like it's carrying kind of a mild clinical course. Scratchy throat is really common. Fatigue and body aches are really common. Also a cough, but maybe not as much runny nose, maybe not as much pneumonia, certainly among those that are vaccinated. The challenge is we know that among those who are unvaccinated, this Omicron variant is causing every bit as severe disease as we've seen with other variants of COVID. This isn't going to be our last COVID variant of concern. we know they're going to keep continuing. I don't know what's going to happen when we finish out the Greek alphabet and we come back around. But what I do know is that the vaccines that we've created so far for COVID work well against Omicron, although you have to have a bit more antibody to really prevent all infections from it. We know we can prevent severe infection. What we're struggling with now is we're coming to grips with the fact that we have not found a vaccine against the common cold, but we think we have found a really good solution to this severe acute respiratory syndrome that's caused by this virus.
You mentioned previous infection and natural immunity, which is a big topic of discussion. And we're hearing that Omicron has figured out a way around natural immunity. Help me stick some facts on that. If you've had COVID before, and are you in some way immune, or is there not much immunity at all based on the science?
Well, this is a really important topic. So my family and I, we were early adopters of COVID. We were infected in March of 2020 after an event with our church. And we all had COVID very early in the process. And it's not something that I would ever want to repeat after 16 days of fever and a viral pneumonia. We all handled it kind of differently in our family. My college-age daughter handled it pretty easily. My wife had a flu-like illness for a week, and I was sickest for the longest. Our other two kids did extremely well. What's interesting is that I work in a research laboratory and may or may not have had the ability to measure blood and look at the levels of antibodies that were created right after the infection. Depending on how sick we were in our family, we had higher or lower levels of antibodies. I had the best. I'm not bragging, but I had a lot of antibodies and they were really good. I still got vaccinated because over time, even my really good antibodies started to fall. And I knew I was going to be exposed through work, and I knew that there would continue to be transmission in the community. Here's what I think we have to appreciate. When you have wild type infection, you do develop an immune response. But the milder the illness, the less robust that immune response is. Does it mean nothing? Of course not. It means something. It's just not going to necessarily prevent all infections. Will it prevent severe infections? Often it will. But it doesn't do it routinely and as perfectly as we'd like it to. So for those who are at high risk, maybe because of obesity or heart disease, lung disease, those that are elderly, I don't think we can rely just on that wild type immunity that comes from being infected. I think the combination of infection plus vaccine, that's a powerhouse combination. And it's one that I'm certainly relying on as I go see patients and as I interact in our church or in our community, trying to make sure that not only am I not becoming infected, but more importantly, that I'm not spreading it, right? We're at a point in the pandemic now where enough of us are vaccinated that by and large, I'm going to be protected against severe disease. But I have far too many friends who are either immunocompromised or unvaccinated for some reason. And I really want to protect them as well.
We're talking now live here on Facebook with Dr. Buddy Creech. He's with the Vanderbilt University School of Medicine in Nashville and a leading voice when it comes to research, not only on COVID, but also COVID therapeutics and the COVID vaccine. So what I'm hearing from you and from others here in our area, specifically the Ballad Health and Niswonger Children's Hospital, is if you are not vaccinated, get vaccinated now. If you are not boosted and you've been vaccinated, get boosted now. The flip side of this that we're starting to hear from the president is that if you are not vaccinated, you need to prepare for the very real possibility that you could get very sick with the Omicron variant. And I'm hearing you say that's because it is incredibly virulent, highly transmissible, maybe not necessarily more potent or dangerous than the other variants, just as potent, just as dangerous for certain people. What's striking to me, though, is the speed at which Omicron is spreading. The president today said he was stunned himself and surprised by the rate of spread. Do you agree with that? Is that accurate, that we have a variant here that, to borrow the words that I'm hearing, is sweeping across the country?
Well, I think there's a lot of things that go into this. And again, we're still getting our hands around or our head around what Omicron means. I can't say that it's as virulent as the other types of COVID that have come through because I don't think we know enough yet. So I want to put a pin in that one for for a minute. What we know for sure is that it's more transmissible. What we know for sure is that boosting allows us to have far more protection against it. What we know is that those who are vaccinated have very mild disease, and those who are unvaccinated, it really depends on those underlying risk factors as to whether or not they have severe disease. What's interesting about it is coronaviruses are interesting. They represent about 30% of the common colds, and there's about 4 of them that do that. And then at different parts of history, we've had these severe acute respiratory viruses like SARS in the early 2000s, MERS, which was a Middle Eastern virus, and now SARS-2. I think what's interesting about these viruses is that they mutate very readily. They change that spike protein that's studding the outside surface of the virus. That's the main thing that we need to be immune to. So as we develop more immunity, we put pressure on the virus to try to evade that. And that's how it always works with any pathogen. What we try to do in that is make the virus have to tip its hand. I think, quite frankly, as a pediatric infectious disease person, if you told me that through vaccination and some of the drugs that we're developing, that we can turn COVID-19 into nothing more than a seasonal cold, we've won. And the way we do that is by putting so much pressure on this virus that it begins to mutate in such a way that it no longer wants to kill us. It no longer tends to make us very sick. Instead, we force its hand, it mutates. So it might be more transmissible, but if it's weaker as well, that's winning the game. One thing I often tell people is that if I'm a virus, I don't want to make you so sick that you're on your couch seeing no one for a week. If I'm a virus, I'm going to propagate and survive the best if I just make you a little sick so that you're fine going to the grocery store, going to dinner, going to a sporting event, going to church, and spreading it to all your friends. We may be seeing that evolution of coronavirus over time.
Quick take on a couple of the headlines still, and then we'll move on to the question at hand for children and the virus and for parents. The president today is saying 500 million free at-home test kits are going to be deployed in the month of January. Do you feel that's a sufficient response to what's currently happening?
Well, everything we're doing right now is trying to fill in the gaps of a wall that occasionally cracks in places we didn't expect it to. Early on in the pandemic, we did not have good testing availability for COVID, and people were waiting 3, 4, 5 days to find out, oh, I was positive, and here I was going out and doing things. Having at-home tests available may be a really important mechanism. If I can be honest, we wouldn't need that kind of response if in many areas of our country we had better vaccine rates, because one of the challenges that we're running into is that the sooner we can get our population immune to COVID, the quicker we're going to be able to treat this virus as a cold virus rather than a potentially fatal viral infection in those among us who are most vulnerable. So I think that's the real issue right now. We're going to have a ton of stopgap measures until we do the main thing. And the main thing is, one way or the other, people are going to be immune to this virus. They're either going to be immune through a safe and effective vaccine or through getting infected with the virus. Those who get infected, there's going to be some of those who do not navigate that infection very well and are either going to have complications from infection, or they're going to potentially have a fatal infection with this virus. And we know those groups that are most at risk, those that are elderly, immunocompromised, those that are obese or have hypertension, diabetes, the list goes on.
And that brings us to the topic at hand for children. The Niswonger Children's Hospital daily reports its number of children with COVID who are getting treatment in the hospital facility. And today, I believe the number is at 3. We have heard along through the whole process of the pandemic that children are not in that high-risk group for severe illness. Is that still the case? What is the risk to children as we deal now with the Omicron variant?
This is really hard for us to know because every time a variant comes along, we have to assess it almost like it's a new virus. So early on in the pandemic, this was our silver lining, is that this virus wasn't very significant to kids. They weren't getting infected very frequently, we thought. And when they did, they didn't have much in the way of respiratory symptoms. It seemed like a cold. And then we started to see these reports of these children who got exposed or got infected with COVID. And like a month later, they developed this hyperinflammation with red eyes, red skin, red mouth. They had heart failure because of inflammation of their hearts. We have to use very specialized medicine in the hospital to treat them. It's uncommon, but that's been one of the reasons why we've seen some mortality in the pediatric population from this virus. We also know that in teenagers and young adults, some of whom are in that pediatric population, that the frequency of heart inflammation, even after very mildly symptomatic COVID, is far higher than we see with other viruses. They may be familiar with a Big Ten athletic study where 2% of the student athletes in college who developed COVID had evidence of heart inflammation when they were evaluated after their illness. That's a shockingly high number. So I think even though children are relatively under-affected by this virus, we don't yet know the ones who are going to get long COVID, those long-term symptoms of fatigue and cognitive fog. We don't know the ones who are going to have severe pneumonia or have blood clots or heart inflammation after infection. And so because of that, we've really been focusing over the last several months on making sure that we can take what was successful in adults and do the necessary steps to make sure that we've got the right dose in the right amounts in the right way for our younger children.
We potentially have a visual that we could show our viewers and share with you just numbers of the children ages 5 to 11 vaccinated in the U.S. is about 20%. In Tennessee, we're about half that, 10% vaccinated against COVID-19 in that 5 to 11-year-old. And you're looking at that visual here. Northeast Tennessee, where we are, at 9.2%. And then in some counties in our area, it's negligible. We're talking maybe 3% of the children who are vaccinated against COVID-19. These numbers from the Tennessee Department of Health, and that's that 5 to 11-year-old eligible for a vaccine portion of our population. And you're looking at the county by county here. The highest in our county is 15%. But again, that statewide number is at 10%, around 9.2 in Northeast Tennessee. I'd love your take, Dr. Creech, on that number. Are you concerned by from an uneducated layman like me, that it seems like a very small number of children are vaccinated? Are you concerned by that in light of what you know about COVID?
Well, I think I need more information, and this is where it gets really challenging. And I think one of the things we sometimes do in our country right now is everything is either all good or all bad. So here comes some complicated nuance. For those children who have underlying medical conditions, diabetes, chronic lung disease because maybe they were a premature baby, those with underlying heart disease or kidney disease, I really hope they're in that 9% who are vaccinated, because if not, those are the children that we're admitting to the hospital. When I see children in the hospital due to COVID, it's often one of three groups. It's either those who are medically complex, who may even have technology dependence, like a home ventilator, or they have congenital heart disease. The second is the teenager who is overweight. And we don't yet understand why obesity and being overweight is such a risk factor for severe disease, but it is profoundly important for some reason in this virus that the more weight there is, often the more severity there is. And then the third group of kids are those healthy children who get exposed to COVID through normal life, and they don't have a bit of a problem with the respiratory part of it. But a month or 6 weeks later, they begin to have inflammation that's uncontrolled, and we can't predict who that's going to be. Thankfully, that third group is very, very rare. And so I think if there are parents that are on the fence about being vaccinated, this is a conversation with your pediatrician to say, what are the risks? What are the benefits? Because what I fear is that we may not completely understand the benefits of vaccination, and we may actually be overestimating the risks that have been circulated about vaccines. So I think that's really where a conversation with your pediatrician or going to trusted sources, I think that can be really helpful.
Well, I can't think of a more trusted source when it comes to vaccine safety than you, Dr. Creech. So we wanted to ask a question that came in from a submission through the social media platform, and it's basically that. Do you consider the COVID-19 vaccine to be a safe vaccine for children? And if so, what's the science that's made you think this?
Yeah, this is a great question. And I'm going to take just a couple of minutes on this because I think this is of paramount importance. Number one, These vaccines are the culmination of about 25 years worth of work. So we've really been trying to fight against this message that they're too new. I mean, a quarter century, I guess that's new. And as I get older, I'll probably think 25 years isn't that bad, but it's been a long time. We've known for at least 20, 25 years that spike protein is the important thing we need to target. That's number one. Number two is people have been working on mRNA technologies for either gene therapy or other vaccines for 2 decades. And those were going along, and then they came together during this Operation Warp Speed when we tried to respond to the pandemic. Second thing I would say is that we did not rush the vaccine trials. I think Operation Warp Speed and the prior administration deserves a lot of credit for setting us up for success. It was almost a business model of saying, what can you do, Manhattan Project style, if you have the funding needed, you have the commitment needed, and everybody's doing the same thing? You mentioned it in the intro. I work on flu and staph and other vaccines. Not right now. Everything is COVID. We eat, sleep, and then COVID. Like it's what we do. And that's what our HIV colleagues are doing. And that's what our flu people are doing. It's all about COVID right now. The ability to do that made this go quickly. So we didn't rush them. We just did them in a way that government is not typically known for. It's being efficient and effective. And we were able to do that. Third thing I would say is we went through the necessary steps of phase 1 testing, first in people. Phase 2, where we tweak the doses a little bit. Phase 3, where we prove in tens of thousands of people that it works and that it's safe. And that gave us the information we needed. And we did those so quickly because we were already writing the studies and the protocols even during those early days of February and March when we weren't even sure if a vaccine was going to be available. We went at risk and said, let's go ahead and write the protocols as if we're going to be successful. So that's number one. Number two, we took advantage of the emergency use authorization mechanism. Usually vaccines need about 6 months of follow-up data before they can be licensed. In this case, we allowed for 2 months out of necessity. The reason we did that is that when you have side effects from a vaccine, they always start in those first 6 to 8 weeks after vaccine. Now, that doesn't mean you know everything about them in that time period, but if someone makes it through 2 months and there's no new onset of something, we can really reliably say that it's uncommon and unlikely that that has any relationship to the vaccine whatsoever. Third is we understood the biology. We used this in different animals. We gave animals that were pregnant or animals that were newborns very high doses of vaccine to make sure it was safe before we ever put it into humans. And then the last thing is we've asked many hundreds of thousands of people, it's in the millions now, to fill out diaries after each of their vaccines on a special app to be able to track those symptoms along. And by doing that, we've been able to find some rare adverse events or side effects after vaccines, like heart inflammation, about 1 in a million, blood clots after Johnson & Johnson, about 1 in a million. We saw allergies early on, but we haven't seen those types of adverse events that maybe people were worried about, like changes in fertility or other unusual issues. Last thing I would say about this, and I think this is really important, these mRNA vaccines are really the most trimmed down, svelte version of a vaccine that we have seen in a long time. It's really just 4 ingredients. It's the mRNA, which is just the genetic recipe for that spike protein. We've got to protect it because your body gets rid of it really quickly. So we put it in a fat bubble or a lipid nanoparticle. There's a little bit of sugar and salt just to balance things out and a buffer to make sure that it's not too acidic or basic. And that's it. It's not grown in a chicken egg. It's not done, we don't do anything else with it. So because of that, there's really not much in that vaccine that's going to cause problems. That gives us a lot of encouragement as we do the clinical trials. So what have I been doing for the last 6 months? We've been vaccinating children down to 6 months of age in very carefully controlled clinical trials so that we can document ad nauseum every single side effect that they might have: fever, leg pain, achiness after vaccine, as well as those more potentially significant side effects, which we thankfully have not been seeing. So I can tell you that as the parent of 3 children, one of whom is a 4th grader who had disease with us back in March 2020, she's gotten her first dose of vaccine, so she's counted in that 9%, and she was pretty excited to be able to do that.
I think it's important to stress that you are not only a renowned researcher and a physician, but you are a father, and you have given the vaccine to your child. So I don't want to understate that. That's an accurate statement.
It absolutely is. And we did that in full knowledge of the fact that she's had a history of disease, but that was in March of 2020. That was a long time ago. Now, we had a conversation with our pediatrician about a desire to maybe not give that second dose of vaccine exactly 3 weeks later, but maybe do it a few weeks after that, since she did have a history of disease. That's a nuance that I think parents should be able to go to their pediatricians with, just to get a read on whether or not that's an option for their child as well. We would not have done that if any of us in the house were unvaccinated or any of us were immunocompromised or the like. But I think it's important to have those hard conversations with your pediatrician. And the good thing is, those that are listening to this, you have a rich treasure source of experts in the area that can really dialogue with you on this to be able to answer your questions about the vaccine's safety and its effectiveness for your child.
We're speaking with Dr. Buddy Creech with the Vanderbilt University School of Medicine in Nashville. Dr. Creech, another question that we wanted to ask you that we knew of ahead of time speaks to your message to parents who are hesitant. And this, is a discussion, vaccine safety, that was happening in this country before COVID-19 came along, and all kinds of information and misinformation that's been flying for years about vaccines. So the question to you is this: what message would you give? What would you say to parents and children who are apprehensive and who just don't know for sure if it's safe? And I know you've explained the why you believe it is, but what would you say if you could speak directly to them?
Well, I speak directly. Yeah, I speak directly to them a lot, because I think the first thing we have to say is, I think we all want the same thing. We want the health and well-being of our children and those around them. So the first thing is to acknowledge that we all want the same thing, and it doesn't have to be us against them or any sort of adversarial thing. Second thing is to really understand the why. Different people come into this with different reasons. For some, it's a lack of awareness of how severe COVID can be in children. So we can talk about how more children have died from COVID than the last 4 or 5 years of influenza combined. We can talk about the perceived risk of side effects after vaccine, particularly the myocarditis or heart inflammation after vaccine. So usually with those parents, I say, would you rather want a 1 in a million chance of a heart inflammation or a 1 in 50 chance of heart inflammation that we see after infection? I'm personally going to take the 1 in a million chance if given those two. The fourth one is that sometimes we hear people say, well, I'm really worried about giving it to my teenage daughter because I am worried about fertility. And so then we get into the weeds and we talk about the developmental and reproductive toxicity studies that were done, called DART studies, and how there's no accumulation in the ovaries and how there is no impact on fertility, as we can see. And when we saw pregnancies in the clinical trials, those outcomes were just the same in the placebo arm as they were in the vaccine arm. So I think it really depends on the why. What I worry about are those situations where I hear parents say, nothing you say can change my mind. And what I'd want to say there is, I don't want to change your mind, but I do want to give you the right information so that with that information, you might choose to change your mind. And I think during these times of uncertainty, if I, as a person who's been focusing on this for 2 years, will acknowledge that there are some things I don't know, I think both sides can do that and say, we're all in this together. We're trying to get to the same place. Let's acknowledge what we know. Let's acknowledge what we don't. And let's see if we can't find some common ground.
We have come to the end of our time with Dr. Buddy Creech with Vanderbilt University Medical Center. But before you leave, I want to ask one last question. This is kind of left field, so forgive me, Dr. Creech. But this time last year, I bet if I had tracked you down, your Christmas wish was that we get a vaccine rolled out and get it out fast and get it into arms as we were moving into the Christmas holiday. And you would have to say that Christmas wish would have come true. But we have the vaccine now in great supply in our country. We're very blessed. I want to ask you now, what is Dr. Buddy Creech's Christmas wish in terms of COVID-19 for 2022? if you could hope against hope, and we could maybe visit with you this time next year, and hopefully we're talking about something else, but what would it be? What are you hoping for the new year in terms of this pandemic?
Well, I'm going to be greedy, and I'm going to say three things. I'm going to say the first one is that by something that happens or some conversations, that those who are unvaccinated right now will become vaccinated, even if it's just with one dose. Forget boosters, like at least get one dose and preferably two in you. That would be a real favor to your neighbor. Number two is I think we're really close to having some oral medications for COVID for those who are or are not vaccinated, particularly those who are at highest risk, that may be able to stop the virus before it runs rampant and our immune systems freak out and we end up in the hospital. And then the third, and this is the greedy one, is that because we're vaccinating and because we're treating, that we'll continue to force this virus's hand to become nothing more than a seasonal cold. And I think if we can do that, if we can start talking in language, not of case counts, but of hospitalizations and of severity, then we will have considered that a victory.
Dr. Buddy Creech, I feel pretty confident that on behalf of all the families who have struggled and suffered with COVID-19 in the past 2 years and are dealing with it as we speak, thank you for the work that you are doing at Vanderbilt and to try to help make those Christmas wishes come true. We appreciate it and appreciate your time here on this special Ask the Expert segment in cooperation with Niswonger Children's Hospital and Ballad Health. Thank you, sir.
Of course. Thanks for having me.
Our pleasure, absolute pleasure. If you are watching us, this is a special live Ask the Expert segment. I'm Josh Smith with News Channel 11. Our time with Dr. Buddy Creech went a little long, and I'm not going to apologize for that because he is truly one of the leading voices when it comes to research, not just at Vanderbilt, but across the country. But we're just getting started, and our goal here is to help answer your questions and provide information, and we're turning to now some regional experts and caregivers. Joining me next is Dr. Heather Champney. She is a very well-known face around the Niswonger Children's Hospital, board certified in pediatrics, 16 years of experience in caring for children, and she is one of those people who you want to see when you walk in the door at the Niswonger Children's Hospital Emergency Department, oftentimes there. Dr. Champney and her team have been on the front lines of the pandemic now for almost 2 years. Dr. Champney, thank you so much for joining us. We appreciate it. And thanks for your patience as I went a little bit over my slot time there with Dr. Creech. We appreciate your time. Thanks for being here.
Sure thing. Thanks, Josh.
First up, questions for you. We mentioned a moment ago that we have maybe 3 or 4 kids hospitalized there at the Niswonger Children's Hospital where you are tonight. I know you're at the Ballard corporate office right now, but over at the hospital where I no doubt you have been today, what are you seeing in terms of COVID at the hospital? What's your perspective on what's happening there and what's coming through the doors in your emergency department?
Sure. So I think that, that number of 3 or 4 patients in the hospital, pediatric patients in the hospital with COVID, can seem like that's not very much. But I want to reiterate that it is actually, that's a pretty large percentage of the number of beds that we have on both the floor and in the ICU. And that doesn't count all of those kids that have milder symptoms that don't require hospitalization, that are walking through our door every day, all day long, seeking care for their symptoms. And those symptoms are all across the spectrum of things that are very mild, and there's just concern, or their symptoms are so extreme that they're dehydrated and they need to have a little bit of resuscitation in order to be able to go home. So we are seeing more than what a number 3 or 4 might convey in terms of COVID.
That's an important perspective. Go ahead. I'm sorry.
Oh, no, that's it. Sorry. But I was going to say, we also have all of the other things that come along with pediatrics during the winter. As we've talked about before on some of our other Just for Kids segments, we started seeing things like RSV and rhinovirus back in the summer. And that was way earlier than we typically expect those viruses to show their ugly heads. So they've been here plugging along, really continuing to gain momentum. And then we throw in the mix of human metapneumovirus, and I think I mentioned rhinovirus, RSV, and now we have influenza. We have both influenza A, that was kind of what we saw starting about a month ago, and now we're starting to see influenza B as well. So when you take the combination of all of those, what we consider kind of regular winter viral illnesses that stress our system at baseline, then you add to it the volume of patients that have COVID or COVID-like symptoms, and you add to that the other things that we see in the emergency room, which are traumas and emergencies of other sorts. It's a very stressed, burdened system for sure.
No doubt, no doubt. You mentioned the increase in hospitalizations recently because of COVID, flu, and RSV. A question for parents, I think, is, okay, and we've all been there, Dr. Champney. I've got 3 of them, and it is when my children are sick, it's like the world is coming to an end. You know, even if it's flu or things like that that's treatable. What's your advice to parents tonight? Is they're, you know, heading toward Christmas and thinking about a billion things? Probably already had a few sick kids around the house this year. If it's anything like my house with just the stuffy stuff, they've been doing the rapid tests or maybe the tests through their healthcare provider. What's your advice to parents? What can they do to prevent having to be one of the patients in your hospital?
So that's a great question. First, I would say that sometimes you can't prevent it. So if you end up needing to seek services, there shouldn't be shame or guilt that goes along with that. We're humans, and we sometimes need extra help to get through whatever we're experiencing at that time. There are some just good old-fashioned common sense things that you can do to keep yourself and those around you healthy. And those are things like getting enough sleep, not running yourself ragged during this time, because we are a culture that likes to go as hard as we can. But take a pause, go to bed, drink some extra water. We all could use a little more hydration, especially when we are in the heat and it's dry. Eating healthy foods, those are the things that fuel our body and give our body the ability to function at its best. So I would say do those things. And then also wash your hands. Don't go into big crowded areas. Get vaccinated against everything you can get vaccinated against. Not just COVID, not just the flu, but all of our other general pediatric childhood immunizations. Those are very important to continue to do your health maintenance sorts of things. And then along those lines, I would say, you know, one of the greatest gifts that we can give our children, which has nothing to do with our body specifically, but is the ability to kind of develop resilience and coping skills. And in order for them to do that, we need to model those things for them. So really validating our emotions. We're all stressed, and some of us might tip into that overwhelm where we are not able to actually cope with anything. So take a pause, go outside, get some fresh air, count to 10, do whatever you need to do, and model that for your kids. Talk to them about your experiences, your feelings of disappointment or fear, and allow them to express their emotions. Because the words we use them to convey how we feel, but they also can really shape how we experience things. So practicing that shifting of perspective and positive self-talk really can make our experience of something pretty crummy and awful better. So I would say do those things in a nutshell.
Dr. Champney, before we say goodbye to you, as we do have some more guests we want to speak to tonight, I want to ask you, we spoke a lot about the vaccines with our previous guests. You've seen in the emergency department, I bet you've seen it all. But have you seen any parents come into the door with children who've been vaccinated and are having problems with that vaccine? And I think that's what a lot of parents would love to know tonight. Have you seen any problems with the vaccine in children?
No, I have not. No, I haven't. But when I ask patients if they've been vaccinated, those who have, I haven't seen them have any experience with COVID. They're there for something different. And all of the patients that I have swabbed for COVID who are unvaccinated, that end up being positive for COVID, are unvaccinated. So no, I have not seen any poor outcomes from vaccines. I've seen tons of poor outcomes from viruses, COVID included, that we can prevent or at least mitigate.
And I want to make sure I'm clear on that. You're saying that you have not treated any hospitalized children with COVID-19 who've been vaccinated. In other words, the hospitalized children you've been treating have been unvaccinated.
They have been unvaccinated, yes.
Dr. Champney, anything else that's on your heart and mind as we head into Christmas that if you could drop one more thing before we leave and move on to our next guest?
I would just say we have a large burden of folks that have kind of mental health crises that also come into our emergency room. So if you are feeling overwhelmed or sad, reach out to many options in the community where you can get help. I think that's one of the greatest gifts we can give ourselves this season, is the gift of grace and asking for help.
Amen to that. Dr. Heather Champney with the Niswonger Children's Hospital. Thank you so much for your time, and a Merry Christmas, Dr. Champney. We appreciate your time.
Merry Christmas. Thanks, Josh.
Thank you so much. We are going to move on quickly now to our next guest, Dr. Sheri Holmes, a practicing obstetrician who serves as the assistant professor of ETSU's Quillen College of Medicine. She's the chief medical officer for ETSU Health. Before obtaining a medical degree, Dr. Holmes worked for years as a nurse, and she's going to answer some questions. Specifically, we wanted to provide a source for questions to be answered for expectant moms, for women who may be planning a pregnancy. Dr. Holmes, thanks so much for joining us tonight.
Thank you, Josh, for having me.
It's a pleasure.
Very important topic we're covering tonight.
Absolutely, and very appreciative of you taking time out of caregiving and your work in administration, so thank you very much. Let's get straight to it. For women who are pregnant or who are planning a pregnancy, how will the vaccine affect my unborn baby? Has got to be the question on their minds. It certainly would be the question on my mind if it had been a few years ago when we were having children at my house. How will the vaccine affect my unborn baby?
And that's a great question. That's probably one of the most frequent questions we get from women of reproductive age. And what we know about the vaccine thus far, most of that has already been described by Dr. Creech and some by Dr. Champney. What we know about the vaccine, it is overwhelmingly safe. Now, I do want to issue the disclaimer that every person is unique and every pregnancy is unique. So these decisions need to be made in conjunction with your providing physician, your providing OBGYN, to discuss your individual situation and your individual pregnancy. But what we know is that the vaccines actually protect the baby. There have been no studies, no reports of babies who are born that have been affected by the vaccine. And what we are seeing are more favorable outcomes of pregnancies with women who are vaccinated. We do know from a Society of Maternal Fetal Medicine article that was released just this month, maternal fetal medicine is the high-risk society for OBGYN. And the statistics show that if you're pregnant and you have COVID, that you are 3 times more likely to be in the ICU requiring critical care. Even bigger than that, though, is you're 1.7 times more likely to die. And at the risk of sounding dramatic, we have had mothers in this region have babies and not go home with them.
That's not I see what you mean. You're speaking from experience
Yes.
as a caregiver and as a health system. And that had to have been absolutely devastating for all of you. For someone who has found out recently that they are expecting a baby and they want to get the vaccine, or maybe they're on the fence about it, but they're wondering which trimester. Is there a trimester in which getting the vaccine is most recommended?
And again, this is a discussion to have with your provider. If we were in a time of very little disease in the area, you might have the option of deciding which trimester is best. But if you're in a time where the disease is spreading rapidly in the community, the best time is now. You may think that you should delay until later. 3rd trimester vaccinations, the cord blood that we've collected from those pregnancies, they have antibodies from the mother. And that is optimal. But at the same time, when the disease is spreading rapidly in the community, we can't afford for people to not be vaccinated as soon as possible.
There's been so much discussion about the impact of the vaccine on DNA. And based on what I'm hearing from scientists and researchers and physicians, much of what I'm hearing is not accurate. So let's hear from you in terms of the vaccine's impact on a baby's DNA. Is there any evidence that the COVID-19 vaccine in any way alters the child's DNA?
Absolutely not. What we're hearing is RNA vaccines. RNA, DNA. But what the RNA vaccines do is they encode for a spike protein, which then stimulates neutralizing antibodies. No DNA is affected in the mother and no DNA is affected in the baby.
Is it frustrating for you to hear this? Are you hearing it? And what, for you as a caregiver, does it just make you want to throw something?
I don't know if you want me to answer that. I hate to see people suffer needlessly. And like I say, when you have mothers go home or mothers that don't go home with their babies, there's probably no greater loss.
Let's talk about that baby who was born to a mother who was vaccinated during the pregnancy. Is that child, will the mother's baby have immunity to COVID-19, some level of immunity to COVID-19 if the mother is vaccinated while pregnant?
And there's a strong possibility that the baby will. What we're seeing is what we call robust amounts of antibodies around up to 6 weeks after delivery. Of course, the timing of the vaccine is very important as to the level of immunity, but any immunity that you could confer to the baby is more than the baby would have had on its own.
And another question I think many moms would be having is, would be for those who are breastfeeding and who are vaccinated either while breastfeeding or prior to breastfeeding, maybe during pregnancy. Is there any immunity passed on to the child from the breastfeeding through the COVID-19 vaccine?
And there may be levels of antibody that are transmitted through breast milk. Again, that is nothing but a positive for the baby, because babies are born immunocompromised. They have depressed immune systems on delivery and are very susceptible to things in the community. So any kind of advantage we can give these babies is to their advantage.
Dr. Sheri Holmes, I imagine for you, you're tired, and your caregivers are tired there. Helping women and families through pregnancy and obstetrics is an exhausting field of medicine. That's been my experience with them, is that you're working a lot. I just am curious for you personally. The president even today said everybody's tired of this. Is that the case for you and your colleagues?
It really is. And I'm not on the front lines as much as some other people. I do cover the hospital, cover the labor and delivery unit, but the workforce is exhausted right now. They are tapped out. There's not much more they have to give. And so they need the community to come together to help them by getting vaccinated.
Many years a nurse, now a physician and the Chief Medical Officer for ETSU Health, Professor for the Quillen College of Medicine, Dr. Sheri Holmes. Thank you. And a very Merry Christmas. We cannot thank you enough for your time.
Thank you.
Okay, now we also finally have one more guest tonight, and that is Amber Wagner. She is a nurse manager at the Johnson City Medical Center. We spoke a moment ago about just the exhaustion that's now being experienced by healthcare providers in our area. And Amber Wagner, as the nurse manager for the Johnson City Medical Center, has certainly been on the front lines for the pandemic, a mom of two, and taking time out of her evening to be with us in the final few minutes of our Ask the Expert segment here on Facebook. Amber, thank you for your time.
Good morning. Hi.
Hi there. How are you?
I'm good. How are you?
Good, good. I know you had a chance to hear what Dr. Champney and Dr. Holmes had to say a moment ago. You're speaking to what's happening from the perspective of not just a nurse, but also a nurse who's in charge of helping and administering the nursing staff there at the hospital. Your experience working in the pandemic so far, if you could describe it in a few words, what's it been like?
Exhausting, disappointing. We almost feel at this point like it's never going to end, like we're never going to get out of the hole that we're in, no matter how hard we work.
You said disappointing. In what are you disappointed?
I think we're just disappointed. You know, a year ago, the vaccines had just come out, and we were so hopeful. We thought, this is it. This is our chance to end this. We had fought so hard for 6 months or so, and we really felt like it was going to be the end of the pandemic. But unfortunately, not enough people were vaccinated. We continue to see surges and spikes. Our census would go up, up, and up. Our patients were sicker every single time we would have a spike. every time we would put a patient on a ventilator and they would look at us, and sometimes they were able to speak, sometimes they weren't, but they would always say, "I don't want to die." And it was so hard to have some words of comfort to say to them, knowing that once they go on the ventilator, there is a very small chance that they are going to come off.
I think anybody would be disappointed in light of what you have seen. How important, we've been talking about vaccines. You are a caregiver in a hospital where we are told by Ballot Health, by we mean the public, told by Ballot Health that the vast majority of the people who are critically ill in ICU or even just hospitalized, specifically on a vent as well, very few, if any, have, and I always get this mixed up, very few have been vaccinated. The vast majority of the people in the hospitals who are critically ill are unvaccinated against COVID-19. So from your perspective, how important is the vaccine? And that's as a nurse taking care of grown-ups.
Yeah, it's detrimental. I mean, it is the one thing that we have at our disposal that anybody could get that can keep you out of the hospital, potentially off of a ventilator, and save your life. I mean, it can be life-saving.
You're a mom as well, and I'm seeing on the screen here, you know, that's a great question. As a mom, you have 2 children?
I have 2.
How are you handling this whole vaccine thing as not just a nurse who's having to stare in the face of COVID, critical COVID, but also as a mom?
So working in the hospital through COVID, I have been called over to Niswonger to assist with caring for some of the children that they have had who are COVID positive. And every time I went over there, the only thing I could think is, please don't let this be me. Please don't let my kids be here. So the first day that the vaccines were available, my kids are 9 and 10 now. The very first day that it was available for them, we were first in line to get it. And it was a day that I had waited for so long, and my kids were excited. They wanted to get it because they felt like we had talked about, you're going to be doing your part to end this. Because they're kids. They asked me, "Mommy, when can I not wear a mask anymore? When can I go to Just Jump?" Because we haven't done any of those things, because I've sheltered them so much to try to protect them, because I don't want to be the mom of a child who was in Niswonger. I can't begin to put into words how important it is for anyone to get vaccinated, especially the kids.
Now, I know you know people, you know moms and other dads, and you probably know maybe even some people somewhere in the healthcare field who are just hesitant, and I'll just leave it at that when it comes to the vaccine. What would you say to them? And I know if you're like me, you probably just are trying to just avoid the subject whenever you're in a social setting. You know, let's just have fun, be together, try to keep it light. But if you could speak to another parent who's hesitant as a nurse, what would you say?
I mean, I'll try to lead by example, and I say I made the decision based off of the science and the medical knowledge and the experts who are way smarter than I could ever claim to be, that say that it is safe and it is effective, and I've done it for my children. They are now, I think, 5 weeks post their first vaccine, and they have had no complications. They really didn't feel bad after they received it. They may have had a little bit less energy after the second one, but they've done well. And now I can breathe a little bit easier knowing that I have done everything I can to protect my children.
And I would think, I'm interested in your perspective as a caregiver, pardon me, as being a nurse. I mean, if your child does get a vaccine and doesn't feel so great afterwards, is that cause for concern?
No, I mean, any vaccines, even if you go back to when my kids were babies and they would get vaccines, they were usually fussy. They didn't feel well. They may have ran a fever. But we knew that that was a possibility, but we still chose for them to get the vaccines because we understand how important it is.
We're now in another surge, and I'll end with this with you. I cannot imagine what it must be like to have been through the first, the dark days of the first part of this year, and then that surge that came, I guess it was mid-year, and now it seems we're in another surge. How are you all holding up? How are you and the other nurses who are there at the hospital doing?
It's tough. It's really tough. you know, we have some hard times, and you can walk down the hallway and you can just look at somebody and sometimes they start crying because it's just been a really tough day. I know there's days that I pull into the parking lot of the hospital, most days around 5 o'clock in the morning, and I sit there and I think, I just don't think I can do it again. But we know that there are patients there who need us, and we refuse to give up. And we are going to continue to fight and take care of people who need us until we can't do it anymore.
Amber Wagner is the nurse manager at the Johnson City Medical Center. Amber, here's hoping Santa's real good to you and to those 2 Wagner kids this year. I hope it's a happy Merry Christmas for your whole family.
Thank you. Merry Christmas to you.
Thank you. And on that note, I want to say again, thank you to Amber Wagner, nurse manager at the Johnson City Medical Center. Also to Dr. Sheri Holmes, an obstetrician with ETSU and also ETSU Health in the Quillen College of Medicine. Thank you to Dr. Heather Champney with the Niswonger Children's Hospital. And again, thank you to Dr. Buddy Cheek, who is with Vanderbilt University Medical Center. If you have made it to the end of this hour-long Facebook Live, we first say thank you. You deserve a prize, a lollipop for sure. And we want to say as well that you're probably at this point because you want information. If there was a question that did not get asked, or if you had a question that did not get answered, I am told by Ballot Health that there will be an effort to make sure that question gets answered on social media. If you are viewing this through the News Channel 11 platforms, we're going to do our best to make sure that the experts in healthcare, that is not us, that people who have knowledge maybe will take a look at those as well and reach back out to you. We very much want to thank you all for watching tonight, and to encourage you to listen to the information that is coming from the scientists, from the physicians and the caregivers and the nurses and the people here in our community who have access to knowledge, firsthand information, and who now are unfortunately approaching almost 2 years of dealing with a pandemic. And it is from them that tonight that you will hear an interest and a high desire to try to share information so that others can be safe and well and have a good Christmas. I'm Josh Smith with News Channel 11. Thank you for your time. On behalf of everybody I know at Ballot Health and Niswonger Children's Hospital and ETSU Health who wanted to make this broadcast event possible, thank you for watching, and we hope you do have a great evening and a very Merry Christmas.